Dr. Mendel wanted to mention one more thing for this anatomy lesson, and that is in children or babies that are still within mother's womb, they don't have fresh oxygen going to the lung. Therefore, mom's blood is delivering them fresh oxygen. So we do not want to have the baby's heart shunt or putting blood to the lung so it gets shunted away. The way that that happens, if you look inside the right atrium, we can see a remnant, basically scar tissue of the fossa ovale. The fossa ovale would shunt blood in a baby in mother's womb from the right atrium directly to the left atrium through the intraatrial septum. Therefore, that blood that's oxygenated from mom bypasses the right side of the heart and doesn't go to the lung. It would simply go into the left ventricle and therefore go out through baby's aorta. The second thing is some of that blood still may go through right ventricle. If it does and gets pushed up through the pulmonary trunk, there was an opening here, a bypass called the ductus arteriosus. That ductus arteriosus allows the blood to go straight from the pulmonary trunk into the aorta and again bypassing the lung. After baby is born, this should no longer be open. It will dry up and become a ligament appearing structure called the ligamentum arteriosum. So it's dried up. If that is to remain open in a baby, it's called a PDA, which is a patent ductus arteriosus, would require surgery because freshly oxygenated blood would not occur as much because we're sending deoxygenated blood instead of to the lung back into the aorta, which would be bad. Sometimes the fossa ovale does not close properly after birth, and even as adults, some people may have a hole instead of a scar tissue, and that's called a PFO, which is a patent fossa ovale. Both might require surgical intervention depending on the size and severity. And that is it.